Hi, everybody. My name is Bobby Gordon, and I am your host today for the Regen podcast for the UC San Diego Sanford Stem Cell Institute. I am here today with Dr. Joel Castellanos, and he is one of our trial experts with the Sanford Stem Cell Clinical Center. Welcome.
Nice to be here.
We appreciate you being here. Thank you so much. Tell us what do you do at UC San Diego, and how are you involved with the Sanford Stem Cell Clinical Center?
Yeah, so I came to UC San Diego from University of Michigan, where I did my physical medicine and rehabilitation residency. For people who don't know, physical medicine and rehabilitation is a medical specialty after medical school, just like anesthesia or radiology or surgery. It's a 4-year residency. And I came out to UC San Diego originally to do an interventional pain fellowship after that residency. And when I was in the throes of my fellowship year, I realized that UC San Diego didn't really have any physical medicine and rehabilitation physicians who were focusing on rehab. And what that means to the layperson or the someone who's not familiar with rehab medicine is after someone has a spinal cord injury, a brain injury, a stroke, an amputation, a burn, really anything that unfortunately leaves them with an acquired disability, these people's lives are turned upside down in the matter of seconds. And when you're in that medical state acutely, it requires a whole team of people to guide you through that process, to optimize your functional recovery, to coordinate the rehab and make sure that to the best of our ability, get these patients back to doing what they need to do and want to do and have a good quality of life. And most big academic institutions have a really robust rehab footprint and presence. And I came at University of Michigan. There is, around 50 rehab doctors, PM&R physical medicine and rehab doctors. And there are some at UC San Diego, but no one was really focusing on the rehab aspect of that in helping build the infrastructure to guide those patients through that really traumatic, chaotic process. And when I saw that, I'm a Midwest guy. I spent one winter here and knew that I wanted to stay in San Diego. But I also saw that there was a huge need to grow that infrastructure to deliver the best care we can for these patients. And so after my fellowship year, I stayed on. I became the medical director of rehabilitation here at UC San Diego, fresh out of training, which was a learning experience, and learning how to navigate the big academic institution as an attending rather than a trainee, and splitting time between the pain clinic and trying to grow this rehab infrastructure has been a great learning experience, and we've done a lot of great things. We've created spinal cord injury guideline protocols for patients who are hospitalized to really optimize their function and recovery. I've partnered with a lot of the local inpatient rehab units and their medical directors to optimize our patients' chances of getting into one of these necessary rehab units. And fortunately, UC San Diego is getting ready to open our own inpatient rehab unit, which is really the necessary part of the continuum of care where these patients who have these acquired disabilities learn how to live again. Mm-hmm. And with the goal of going home after that. So because I've kind of planted my stake in the ground and been politely screaming at the top of my lungs that this infrastructure needs to be built, it's opened a lot of different doors for research, and realizing that missing this big piece of the continuum of care from inpatient hospital to rehab unit to outpatient, missing that middle piece sometimes can make doing research on these different patient populations difficult because we're missing that core presence.
Sure, that makes sense. I appreciate that you say continuum of care. I think a lot of people, think, oh, one and done, right? And I've been injured, and that's it. So, it's really nice to know that there's a holistic approach. Tell us a little bit about the tie-in then to regenerative medicine and how that works. I mean, for me, it's a bit obvious, but maybe not to some of our listeners.
Yeah, I mean, ever since I've been in the rehab medicine space, ecosystem, whatever you want to call it, there has been this holy grail of helping cure or improve the function of patients with spinal cord injuries through different regenerative approaches, whether that's stem cells or even like platelet-rich plasma. There's this burgeoning field of focus specifically for patients with spinal cord injuries to potentially give them the ability to have neurogenesis, to kind of heal that area where the spinal cord is injured. And I love that the Alpha Clinic has a focus on that because it really is important. And as someone who is seeing these patients every day, like the day after they have a spinal cord injury or a stroke or a brain injury, they're scared. They're really scared. Their whole world has just been turned upside down. And to communicate with them that not only are we building the appropriate infrastructure to help you with the current standard of care, but we also have developed this great team of really smart people to push forward the standard of care and to find ways to enhance recovery that previously didn't exist.
It sounds to me like you've got a really good plan in your head, not only for the infrastructure plan to bridge that gap in the holistic continuum of care, but also it sounds like you've got somewhat of a plan for potential clinical trials.
Yeah, I think that UCSD is such a strong institution from a neurological standpoint. We have experts in every single nuanced neurologic condition. And by growing this infrastructure to basically complete the continuum of care, it allows us to execute trials at all of these different phases of care. And it's something that, because there hasn't been a big focus on the rehab medicine part from UCSD up to this point, there's going to be a ton of opportunities to bring in more NIH funding, but more importantly, help these individual patients and give them the confidence that, yeah, here at UCSD, we want to not only save your life, which we do a great job at, but we want to save your lifestyle. We want to make sure that through these acquired functional disabilities, we are giving you the tools to be successful.
That is an amazing way to look at it. That we talk a lot with the folks that work in the Alpha Clinic at the clinical center about the difference that they're making in people's lives. But I don't think a lot of folks, especially our listeners, even have an idea of a lot of the infrastructure and the choices that you're intentionally making and recommending go into place, and that you're laying the foundation for, that then make that difference in those individuals' lives. Yeah,
I mean, it's seeing these patients every day is very motivating. To meet them and to see like how scared they are and how chaotic their life is. And when you're admitted to the hospital, it's a scary thing anyways. But then when you couple that with not being able to move one side of your body, or all four of your extremities, or not be able to get the words out through like aphasia after a stroke, it compounds. And you think about our own family members, but each of these patients deserves to have a team that's guiding them through that process and giving them a peace of mind to say, hey, like, I know you're scared. I know that all of this is chaotic, but we have a team that's guiding you through this. And we're going to do everything in our power to make sure that we get you back as best as we can. And it's motivating, but also really rewarding to serve a little bit of that role when I'm meeting these patients and I can say, hey, we're gonna try our best to get you back. And I'm not going to be done seeing you. This is not a one-time consult where I see you one time in the hospital. I have formed relationships that have lasted the whole time I've been here. A quick example is a patient, my first day as an attending, there was a patient who had basically a complete total body surface area burn. Really tragic, was in the hospital for over a year. And fast forward 5 years later, I see him in my clinic every 3 to 4 months. He's living home independently, has a stable relationship. And it's really cool just to see those patients where you're like, man, I don't know what it's going to look like for this patient I don't know how we're going to kind of reintegrate them into some semblance of life that has a good quality of life and able to function. But time after time, like, people prove their resilience to me. Mm-hmm. And it's awesome. It's like living a tearjerker movie every day.
Right.
And it motivates me to push the status quo and to say, hey, we can do better. We can build this. We can impact so many people's lives by just adding this simple piece of infrastructure and growing the focus on rehab medicine. And that's kind of really what I'm all about. That's when I leave, when my career is done at UCSD, I want to look back and say, I have helped build the infrastructure to create a system that is going to help really vulnerable patients in perpetuity. And that's kind of my main focus right now.
That is an amazingly inspirational vision that you have. Thank you for the work that you're doing.
Yeah, appreciate it.
Switching gears a little bit. So how did you choose this field? I mean, I am also from the Midwest, so I'll forgive you for Michigan since I'm Ohio State. So there's that. But
well, so I grew up in Toledo. I was actually raised an Ohio State and Michigan fan, and wow. I went to both schools, but I did my undergrad at Ohio State. So
divided household.
Divided, yeah. But my allegiance with sports lies with Ohio State.
All right.
Yeah.
Fair enough. So how did you choose this field? What made you go into this?
When choosing a medical specialty, as anyone who has navigated medical school, is a really crazy experience, because in your second and third years of medical school, you're tasked with trying to figure out what you're going to do for the rest of your life based on 6 to 8 week rotations. And I think just at baseline, I'm a pretty curious and easily entertained person. So every rotation, I thought, whether it was surgery or OBGYN or psychiatry or neurology, as I rotated through them, I thought that was going to be my specialty. And then my final specialty was an elective in physical medicine and rehab. And I really resonated with how caring and compassionate each of the physicians that I worked with were, in a way that was both focused on specific problem issues, whether it's managing pain after a stroke or spasticity or neurogenic bowel and bladder or all these rehab specific diagnoses, but also like taking the 10,000 foot view and being like, okay, like, this is a person, and we need to understand how to help this person within the context of their life and their community with the resources that they have. And that was unique for me. And that was something that I really resonated with And kind of why I went into medicine to begin with was to treat the person. And I have kind of taken that approach with pain medicine. And I really kind of view it as an overlap where through this PM&R or physical medicine and rehab training, it's allowed me to, inside and outside of medicine, like treat people as a whole person. And so that's really what drew me to it. I would say that, in general, the whole medical training process is very internally focused. Like when you're an undergrad, you're focusing on your resume and getting research experience and making sure you score well on the MCAT. That happens again in medical school and then in residency where, really there's 12 to 15 years of people who are focusing on making sure their resume is as good as it can be to get on to the next step to get the best training.
Sure.
And I felt like PM&R residency was one of the first things that took me out of that. I remember second year of residency, there was a patient who, a construction worker, 25-year-old kid, was unfortunately electrocuted and ended up having to have 3 of his 4 limbs amputated. And I was in the throes of the toughest part of like residency for me and was having a little self-pity, which I think everyone tends to do from time to time. And I remember going in, he was the first patient I saw, and he was smiling. He was, "Good morning, Joel. Like, hope you have a great day." And it was really eye-opening to me to be like, oh, I have nothing. I have nothing to have self-pity about. I have nothing to worry about. Like if these people, it just shows how resilient people are and how like your attitude is kind of like a state of mind, and experiencing human resilience every day it gives me the ability to remain gracious and motivates me to appreciate the things around me, but also continue to work to build this infrastructure.
That's great. For me, from my observations and working with the team at the Alpha Clinic, we want to create that environment that supports that holistic healing. And it's amazing how resilient people can be if you give them the right footing and the right foundation to be able to have that freedom of thought and that positivity, and that it's not just all about their injury or all about their lived disability that they've now acquired, right?
Yeah, it really is inspiring to see how resilient people can be when they have the appropriate tools. And also, sadly, the opposite, like when people don't have the tools, how it can really change the trajectory of their life. And so I'm super positive, and I'm constantly trying to stay positive on the growth of this, but it's important because the lack of it can be devastating for people.
Absolutely. You talked about medical school and the training and trying to decide in your second and third year exactly what your focus would be. What would you recommend to students that are in medical school that might want to go into regenerative medicine or these tangential areas of focus for research and or practice?
I think that it's such an individual decision. I will say that. What I did was I tried my best to follow what really got my antennas going. What I would try experiences where I wasn't sure how it would necessarily benefit the end goal. And going into med school, I just knew, as cliche as it sounds, like I wanted to develop tools to be able to improve the human condition, but I didn't know how that was going to work. I didn't know if you would have told me when I graduated from Ohio State with a nutrition major and a dance minor
Aha.
that I would be living in San Diego, working with patients with acquired disabilities and working with the Alpha Clinic and also studying the potential use of psychedelics in these different conditions, including pain, I would have been stoked, but I would not have told you what that path was going to be. And I think that's always been my approach, is to kind of learn, prepare yourself for opportunities that don't exist yet, and to explore things that kind of blow my hair back. And I think that's what led me to the opportunities that I've had. And I get that same sense with a lot of the other people in the Alpha Clinic.
Mm-hmm.
I think that if you did a survey of the people involved, like, this is what you'd be doing, it's pretty crazy.
Yeah. It's a very unique environment to work in, and it's very motivating.
Yeah, very motivating, and from my experience, like, pretty low ego too. Mm-hmm. Like, that there are really smart people in these meetings, in these conversations about how we change medicine, but there's no stamp of ownership that I've experienced. It's about, like, getting the job done. Mm-hmm. And people just want these things to be successful and to get completed. And I love working in those type of environments where it just seems like such a well-oiled machine, and everyone knows their role, and everyone is important.
Well, it sounds like you picked a good place to set up the infrastructure that you're looking to do.
Yeah, absolutely.
Yeah. What excites you most about what the future holds for research, clinical trials, those types of things in regenerative medicine, stem cells, that's related to your area? What's on the horizon that you're most excited about?
I am most excited about being able to do the research here. Building the infrastructure that where we have the whole continuum of care, to be able to more aggressively seek those NIH dollars and seek these grants that currently we don't really qualify for because we don't have that rehab unit piece. I'm interested to build that infrastructure to be able to couple how great we are neurologically with rehab medicine, because they're very synergistic. And with how much infrastructure already is at UCSD, whether it's through ACTRI, Alpha Clinic, there's just a wealth of resources here. Mm-hmm. That for rehab medicine, this has been the missing piece, and we have the opportunity to do really great things through the vehicle of regenerative medicine for patients with all of these different rehab conditions, whether it's phantom limb pain after an amputation, post-stroke aphasia, post-stroke weakness, spinal cord injury, burn. The amount of directions that we're going to be able to go is going to be pretty limitless. And for me, as someone who's been trying to build this infrastructure, because there's so many directions and opportunities for growth, it's important for me to be able to collaborate with people who have specific interests, like working with Dr. Chachi on a spinal cord injury trial, or working with some of the plastic surgeons on how we improve phantom limb pain. And so it's been really fun to partner with these different people who have a more specific focus to grow the whole infrastructure that way.
What would you say to folks who are a little bit skeptical still about stem cell regenerative medicine research, clinical trials, that whole area? What would you say to people who still have doubts or question it, or even its validity, let alone its implementation?
Oh, I mean, I think that skepticism is healthy, and I think it's important. I think that it's the job of the researchers to prove those skeptics wrong. And I think UCSD and the Alpha Clinic has the perfect team to continue to demonstrate that, hey, there's validity to this, and it's can change people's lives.
That's great. Thank you, Joel, for all of your thoughts.
Yeah.
I look forward to seeing what you build and what you continue to bring to the table, and looking forward to the clinical trials that eventually will come up because of this. So
I'm super excited as well. I hope the next time I'm on, we have several clinical trials going. And
you beat me to it. That's
Yeah.
exactly what I was thinking.
Yeah.
You got it. So Thank you so much.
Yeah.
We appreciate everybody for tuning in for this episode of the Regen Podcast, UC San Diego, Sanford Stem Cell Institute. Thanks.